check for your safety first, because if you are in the street and you see there's an emergency, it is important that you check for your safety first before you check the person who is in danger or the emergency that there is. As long as you are still willing and wishing to practice as a registered nurse or as a nurse in South Africa, you will be expected to accrue CPD points and you will be expected to comply with the CPD points. It is important to align your trainings according to your discipline or your discipline that you are aspiring to work in. Good morning, my name is Khululwa. I'm a nurse consultant and a director at Intellect Consultancy. Our services are, we're developing nursing educated related content and aligning it with SUNC CPD framework. We also provide clinical facilitation services, nursing management, talent management and resourcing. We also provide health risk management and auditing. Also in that services, you get clinical governance, mentorship programs for both postgrad and career pathing. Today we are going to be discussing something that has been making nurses anxious, which is compliance related. We're talking about South African Nursing Council CPD framework. What is a CPD framework? So according to the Nursing Council, nurses are supposed to complete their SUNC CPDs, which they need to accrue about 15 points for the year. And it has a CPD cycle, which starts from July, the 1st of July to the 31st of June, to 30th or 31st of June. 30th of June, right? So the CPD cycle allows you to complete your learning content for you to accrue your 15 points so that you will be able to attain your licensure. At this point, Nursing Council has not finalized the accreditation process and has not finalized when will the APCs attach to the CPD points. So we are at implementation phase. According to the CPD framework, we are going to break it down as into what is it, what does it mean for you as a nurse at home, as a healthcare establishment, or whoever else hires nurses out there. SUNC CPDs are meant for nurses to improve their skills on a day-to-day. So we have been doing trainings in the practice, but however, we were not attaching them to any points. And Nursing Council has made this mandatory, so to encourage us to upskill all the time. That is why it's called continuous professional development. This is mainly for making sure that we practice with evidence-based practice, as you would attend your researches and then be able to apply what you learned from the research program, or maybe go and attend a seminar and be able to come and share with your colleagues and then be able to apply that in the work setting. So what does this mean for a nurse at home? And what does it mean for the employer? This means that in the near future, nurses will have to acquire or accrue points to have their APC registered for the following year. As it stands, or currently, we know that we have to pay for our registration just before the 31st of each year, 31st of December in each year, or otherwise by January the following year, you are deregistered. It is going to work the same, but at this point, it's now going to be even harder, because if your CPD points are not submitted at SUNC before December or before the 31st of December, you are standing a chance of being deregistered for not accruing the points and for not being able to be compliant with your CPD licensure and the registration thereof. What does it mean for all categories of nursing? All categories of nursing are expected to accrue points according to 5 themes or domains. These 5 themes are area of practice, ethical and legal, leadership and management, research and teaching, and each domain has points allocated in it. Area of practice, you have to accrue 6 points. Ethical and legal, you have to accrue 4 points. Leadership and management, you have to accrue 3 points. Research and teaching, 1 of each to make the 15 points. Now we know that we have categories in nursing that are different according to scope of practice. And I'm going to highlight the nursing auxiliary, which is now, according to the new curriculum, it's the higher certificate in nursing. Those people will just have to acquire 15 points, but they don't have to do the teaching and the research because their scope of practice doesn't allow them to, and so are the enrolled nurses. However, anyone else who is above that, their 15 points forms the 5 domains. According to this phase of the implementation and the phased-in phase, it started 2024 July to this point. I think we are now in the 2nd or 3rd year of the implementation, according to the Nursing Council. So who has been part of the phased-in implementation? Nursing Council decided that because it's going to be haphazard if they just say start to everyone, they have then started with certain hospitals, certain groups, and those groups in the past 2 years were the one that were expected to cascade the process down. So as we speak now, we are in the middle of the process. The goal for Nursing Council is that by 2029, everybody else will be doing the CPDs and submitting the CPDs. So now, if you are employed at private healthcare, you know that everyone is on CPD. If you are employed at public, I'm sure you have heard about certain hospitals speaking about the CPD implementation and the piloting phases. So in the public sector, I know that the hospitals that have reached out to me and the districts that have reached out to me for assistance in terms of aligning their programs with the CPDs, we have been working on specific groups, but the most group is the professional, which it started with operational managers. And in the private sector, it was unit managers. So cascading that process down, you take a certain group, you cascade down, you take the next group, you cascade down. So according to the hospitals per that district. Otherwise, it is the same process for everyone. It's the same compliance regulation for everyone.
Does this include nurses who are also unemployed? How do they fit into this whole thing?
For as long as you are a nurse, you have to accrue CPD points, which is why then it is important that if you are unemployed or if you are working under agency, because in South Africa we have got agencies, nurses that are working under agencies are falling under the category of being unemployed. So if you are working under agency and you are unemployed, maybe you are at home for whatever reason, maybe you were sick and you've asked for deregistration, which is sometimes a voluntary thing, or sometimes you were deregistered for something that has happened. So those people are still expected to accrue the CPD points, and they are still expected to comply, because as long as you are still willing and wishing to practice as a registered nurse or as a nurse in South Africa, you will be expected to accrue CPD points and you will be expected to comply with the CPD points. Therefore, those people have to find their way of doing their CPDs, because obviously they don't have an affiliated employer who will be providing them with, maybe supporting them with the resources to be able to complete those CPDs.
100%, I do hear you.
So the platform at Nurse Intellect provides for the opportunity for everyone who is willing to start now, so that you can be able to have a platform that will provide you with the opportunity to pilot for yourself, because complying with your professional regulation is your own process. It is your own responsibility as a professional. Therefore, you are responsible to finding your own person or your own platform or your own trainings. When trainings are announced, you are responsible to make sure that you attend those trainings, as long as they are aligned with the domains that you're supposed to accrue your points at. I mentioned that there is area of practice. I just want to make an example so that one can understand what do I mean by saying make sure that the trainings are aligned. Your area of practice could be primary healthcare, for example, or could be ICU and emergency nursing. Therefore, it is irrelevant of you to attend a training that provides childcare nursing, because then those points, when it's time for submission, they would be invalid because they are not in line with your area of practice. Therefore, it is important that when you select your courses that you are attending, you don't just go to any training. Make sure that you are intentional with your trainings that you are attending.
Okay, so now I do have another question in terms of how, with this training that people are supposed to attend, is there a form within the training that guides you in terms of if you were in a public setting and there was a emergency, a medical emergency, and you were a nurse, in terms of can you assist? Because sometimes you come and you assist in an emergency setting, and unfortunately the person dies. Is that training also, is that part of the training to guide you as a nurse even outside of duty when an emergency arises?
An emergency that meets you in the street, it just meets you in the street. Unfortunately, it is like just anybody else. It is very important. So that is a basic life support rule that you are referring to. Basic life support rule says check for your safety first, because if you are in the street and you see there's an emergency, it is important that you check for your safety first before you check the person who is in danger or the emergency that there is. If then you need to attend to, if you can't, call for help, because there is no guideline that is specific to say, I'm a nurse, therefore if a bus crashes on the street, I need to go there first. No, if I see that that is not for me, I have no capabilities in assisting there, it is imperative that I call for an ambulance, call the police, call them. We know that the firefighters get first on the scene. Call the firefighters, I don't know for what, but they are obviously trained maybe for basic life support, so they can help with first rescue. But as far as the nurses' training, there is nothing that is there that says if you are on scene, you are responsible for the scene. No, you are a person on scene. If it's not safe for you, if you are not capable for help, call for help. So I wanted to talk about the POE in line with what needs to happen with your area of practice, your domains, and the likes. So those trainings that you attend will be going to your POE, which is your portfolio of evidence. And the portfolio of evidence will randomly be audited by South African Nursing Council. At some point when they feel like they need to audit people, you can be on that stratified sample, because they will be just using sampling, either stratified or random sampling, depending on whatever they want to achieve on that particular moment. Then you might be there. Now, imagine you have just attended any training and it doesn't align with your area of practice, or it doesn't align with any of the domains that are there. Your POE stands a chance of being scraped off and invalidated, because now it is not in line with what is required, and your year of your CPD has been wasted because you have just submitted something that was irrelevant to your area of practice. Because remember, I said to you in the beginning, the CPDs are meant for upskilling. It's trainings that are there to ensure continuous professional development, to ensure that we are keeping up with, abreast with the information that is out there. We keep training, we keep upskilling ourselves, we keep refreshing our minds, because it doesn't mean that you're going to get new trainings. No, it's a refreshment of the trainings that you will be getting from what you have been doing over and over. But because at some point you learn things and you get to rote do them or rote learn them. Example is doing observations. We know that as a nurse, the skill of observation is something that is embedded on us from the word go. But as we go in the profession, when a junior comes to you and say, I have done the observation, the blood pressure is this much and that much and whatever else, the next best answer is repeat them again. You have lost the skill of observation, which is meaning you must go there and look at the patient before you say, I'm satisfied with the clinical picture, but just look at, do the observations again so that you can see if there's really something that I need to be worried about, other than there was something that happened and the blood pressure maybe increased, or maybe the patient was anxious at the time and the vitals were altered at that time that they were done.
Okay, I understand. You did mention something about when you do CPD, when you accumulate your CPD points, it needs to be according to what you're doing. So what happens now, I'm a nurse in primary caregiving, and I do my CPD, and for some reason I get a job as a nurse to practice in a different nursing umbrella. What happens to my points? Are they still valid? Because I'm done for the year, but I switched jobs.
That is why you need a portfolio of evidence. One, the portfolio of evidence is to show that you are following the regulation. So as someone who has been in the hiring process as a nursing manager previously, when we look at your CV, we can already tell the type of a person you are. By the time I interview you, I already know what I'm looking for more than what you are presenting on the CV. And I can already tell if I'm hiring you or not. So bringing the portfolio of evidence is going to be a new requirement now, because it's going to tell me what your career pathing is. And going for your CPD trainings also tells the next person that you are aware of your gaps. You know where you are lacking and you know your areas of development. Therefore, those are the things that you need to be aware of. So if you intend in switching jobs, start already having those kind of trainings, so that when you go to a next interview and your portfolio of evidence is asked for, you can be able to present it and actually show that looking where I was and I started having interest in this kind of work, I started learning more, looking at the fact that, yes, as a professional nurse, we are trained the same way. But as we are placed differently, then we end up learning differently. We end up being experienced, and our expertise grow in a different environment. Therefore, that requires you to then refresh your memory. If you're coming from primary health care and now you are interested in moving into acute facility and emergency nursing, the procedures there would be your interpretation of a blood gas, for an example. You're conducting your primary survey. So those are the courses that you should have taken then to show interest as into the work that you are now, or the discipline that you're now shifting to. With that being said, it is important to align your trainings according to your discipline, or your discipline that you are aspiring to work in. So as the question has been asked now, how do I then align that training? So we will have plenty of service providers out there. We know that this is now going to be a business for everyone. We have had training providers in practice. We have them now that are there. But are the trainings that they are providing in line with what you have to attain as far as your points is concerned? So those are the things that you need to look at when you affiliate yourself with a specific service provider, when you affiliate yourself with a specific training, even if you're not assigning or maybe getting into a membership to a specific provider, but you are required to take a good look on what the training is about before you attend, so that it doesn't waste your money, it doesn't waste your time, because time and money are equal resource.
Will there be any free courses for the nurses that are unemployed? Do they qualify for some form of a discount or some form of a grant to help them get their CPD points? Because we do know that there's a lot of medical professionals in South Africa that are facing unemployment. And we do know the budget cuts, we do know the Madlanga Commission problems. So how, I'm not sure if I'm making sense.
You do. The free trainings are provided by the employer. So obviously, if your employer is providing trainings for you, they are free to you, because that is their responsibility to provide you with the resources and support you in attaining your CPD points. So for those that need to use free services, those free services, obviously the employer has to make sure that they're in line with what needs to be provided. Also, with the budget cuts and everyone else looking at the economy at this stage, according to the current benchmarks, we know that nursing is starting with the CPDs, but the South African Healthcare Professionals Council has been with the CPD. So you'd look, if you are a nurse that is responsible, I am sure you've already started looking at how do others people do this. So according to the information that is out there, the membership fees that the Healthcare Professionals Council CPD providers start with, it's something like 2.3, and it goes according to categories if it's a yearly membership. But for month-to-month membership, fees differ. It's not a set fee. So that is why for nurses as well, you will find those platforms like this one of Nurse Intellect Consultancy. If you go to our website, you will find that you have an option for membership to be able to have open access for the CPD cycle and open access for all your short courses that are there if you have signed up for a yearly membership. But if you take your pay-as-you-use option, then the courses that are there, you would pay for them according to the price that is there. According to the questions that I have been asked, so I'm going to take just a few questions that people have been asking on the side regarding the CPDs. Somebody said, Sister Khululwa, why is it that now we have to do CPDs and we have to pay for ourselves? And it is unfortunate that we have to pay for ourselves. I'm counting myself as a nurse in this question. It is unfortunate that we have to pay for ourselves. But if you are, like I have said, if you are fortunate enough to know a training provider that can negotiate a discount or can offer discounted trainings or can offer free trainings, arrange those. It would be beneficial to all of the nurses in your facility. And unfortunately, again, Nursing Council will take out a regulation, and how it goes on, it's your responsibility. They have regulated this, and it is what it is. And we have seen again that Nursing Council posed a fee structure for service providers. That already tells you that the trainings won't be free. Because the moment the training providers start paying, and it is not cheap, because for a private training provider like myself and some companies like us, so I'm myself and us in this situation, because sometimes the companies would call me and ask for a specific training, so I charge a specific fee. But when the organization itself is contracted, then it's a different structure. So if you are an organization and you want to contract us for trainings, then it's a different structure for you. It's a different packaging according to the number of staff that you want to work, according to the duration as well of the trainings. But if it's a once-off training, it's a fee for service. Another question that I have been asked is, what happens then if I am abroad and I am working in another country? Is Nursing Council going to consider my trainings that I have done in another country? Well, that I haven't got an answer, a clear answer on, because as far as I understand, the nurses that are abroad maintain both registrations. They maintain both registrations in the country and abroad. So in order for you to maintain your registration here, you would require to attain your CPD points here at home and submit them for you to be able to attain and keep or retain your registration within the South African Nursing Council. I think this is enough for today. You can get us, the full video is on our website, www.nurseintellectconsultancy.co.za. You can reach us on TikTok, you can reach us on Facebook. Thank you.